So as you know, the retinopathy of prematurity at this time is one of the preventable blindness, and it's actually kind of more prevalent in the low and the middle income countries. The ROP associated blindness is almost more than 40% as compared to the high income countries like United States and Europe, where it is still less than 10%. So definitely Asia, Africa, Latin America, they have a very high prevalence of blindness secondary to ROP. So some of the very known risk factors for retinopathy of prematurity is prematurity. The more the extreme the premature the baby is, the birth weight, the lower the birth weight, besides the use of oxygen, the oxygen saturation levels, if they are being used, not monitored, has been noted to be the major risk factors in the development of retinopathy of prematurity. And the recent, some of the WIN ROP trials, they have also labeled weight gain and the insulin growth factor as the causation for the development of ROP. But in the last 5 years, there are many epidemiological studies which have come forth, which are also talking about the neonatal inflammatory stress and the inflammatory markers as playing an important role in the development of retinopathy of prematurity. So I think that is something very important, because we know that these babies are dealing with a lot of inflammatory stress. So I think that is something more advanced we are looking at, to look into all these inflammatory mediators to see how much effect they are causing on the development and progression of retinopathy of prematurity. So we are kind of very well aware of the vascular endothelial growth factor as one of the most important pathway in the development of ROP. We all know that the vascular endothelial growth factor, the retinopathy of prematurity, develops in two phases. The phase one, where there is an arrest of the development of the retinal vasculature, and that is where the VEGF is actually low. It's in the low levels of VEGF. And in the phase two is where there's a development of retinal ischemia leading to retinal neovascularization, where increased levels of VEGF plays an important role in the development of neovascularization, which can lead to retinal detachment and the sequelae of blindness. I think in the recent therapies, currently we are targeting the phase two of the retinopathy of prematurity, in terms of treatment. Laser has been there for, decades, and I think it's still one of the most important treatment options which is available. Besides that, I think in the recent times, since the last decade, anti-VEGFs have taken a primary role in the treatment of ROP. I think bevacizumab, or Avastin as it is called as, is being used all over the world because of its low cost and easy to administer at bedside for the babies. The second is Lucentis, who have recently done a clinical trial by the name of Rainbow ROP study. Although the trial results are still not here, they have not released it. They are down below it, but the only issues which has been noted with the anti-VEGFs is the recurrence of the stage 3 ROP, or the development of stage 4 and 5 after the age of 1 year, the late onset recurrence. So though anti-VEGF seems to be really promising in the treatment of ROP, at this time they also kind of warrants a long-term follow-up for these infants with the risk for the recurrence of the disease. And one of the third, I think I'm more excited about, or I would like to see the role of Eylea or aflibercept, which is kind of being one of the latest anti-VEGF, which is currently, I know that some of the countries have started using it, although it has not been used in the United States at this time for the treatment of ROP. But I think that would be something I would also look into it, considering that Eylea has got a higher affinity with VEGF and has got a longer half-life, to see if that would be more effective in terms of decreasing the risk of recurrence post-treatment.